Well, hi, everyone. Welcome to the data management category. I'm super excited to be here with Anthony. Anthony's the CEO of Professional Credentials Exchange. Anthony, thank you so much for taking the time to do this. I really appreciate it.
You're welcome. Thank you very much.
So to give everyone context of why we're having this interview, Anthony has built a company that we're actually super excited about within the data management space. And they have a really unique approach in the ways in which they're managing what we call the future of identity within healthcare. And their platform that they built and managing identity is quite unique. And so super excited to be talking about and with Anthony and Professional Credentials Exchange today. Anthony, with that, before we even jump into questions, let's jump into some slides that you have to help give the audience a good visual, baseline visual of what you guys are doing.
You bet. You bet. Pull up these right now for y'all. Kyle, can you see these? Outstanding. Well, just for a little bit of context, in 2001, I founded a consulting firm, and for 18 years, we probably had 70% of our revenue come from engagements helping very large healthcare organizations fix problems related to credentialing, privileging, and payer enrollment. This included, very large health systems, very large payers, and then ultimately the U.S. military. We did a very long engagement with them to both fix their reserve component credentialing problems as well as help improve their overall retention for practitioners significantly. And in doing all that work, we went through a lot of technology builds, we did a lot of custom stuff for folks, implemented off-the-shelf technology for folks. And as hard as we worked and as efficient as we could build an operation, we could still never fix the problems related to getting difficult credentials verified, in the market. And these would be credentials like postgraduate medical education, like residencies and fellowships and so forth, employment verifications that were 20 years, in the past, delineations of privileges from those kinds of organizations, and several other kinds. And the typical, method for obtaining those verifications was to send a letter, write an email, send a fax, and then just wait for that organization to respond. In many cases, we would harass that organization for weeks just to get them to respond and give us an answer as to whether or not somebody was employed or somebody completed the program, in good standing and so forth. And that, about 5 or 6 years ago, that gave birth to this concept that has now become ProCredEx. And that concept is very simple, creating a venue for folks to be able to acquire verified credentials from other healthcare organizations in the marketplace, right? So, the bottom line, if you're not familiar with this use case, credentialing in healthcare is mandated, slow, expensive, and redundant, right? You have to do it. It takes on average 4 to 6 months from the time somebody says, I want to work with organization X or Y, to the time that they are fully credentialed, privileged, and enrolled with that organization's payer contracts. In the meantime, organizations are forfeiting anywhere from $600,000 to $900,000 plus in real revenue, net revenue, for every hire that they make, simply waiting for this process to play out. Finally, practitioners hate this process because it is totally redundant. No one shares any information, and they're often maintaining 15 to easily 25 plus independent credential data sets with every organization that they either work with to deliver care or work with from a reimbursement perspective, right? And it's just a massive administrative burden that's placed on these folks. What we've built is a digital marketplace to help healthcare organizations exchange verified credentials data within an environment that both ensures trust and aligns incentives for all participants. The use cases that we have in the marketplace are very simple, right? You can look in the marketplace for verified credentials that your organization is seeking for a provider and buy them from an organization that has done that work already. You can monetize or sell your information by posting it on the exchange for others to acquire from you. And you can also serve your customers if you're in a situation where you employ someone who then needs to work for someone else, and they require that person's credentials in order to get them to work, right? And that's a use case we have called Share. This frankly was born directly as a result of the COVID-19 epidemic, where large telemedicine firms, local attendance organizations, clinical staffing firms, and so forth required, the ability to get information to folks quickly and get them privileged and get them working, right? Instead of taking 3 or 4 months to get that done. What we've also developed is what we call an environment of trust. And why this is so important is that in healthcare, credentialing is a very, very important process relative to patient safety, right? The credentialing ensures that someone is clinically competent to perform the work that they're being asked, or they're asking, one of the two, to do, right? And how we've built this environment is, one, building a network of healthcare organizations that are high quality, or prioritize, I should say, high quality data management and credentialing processes. We only allow the members or folks to be on the network who have a need to do credentialing. We're not in the provider marketing and data business. We're simply creating a venue for organizations to exchange this verified credentials data. We have a community-based quality management process where if somebody inevitably finds an error on the exchange, they can report that error and others can vet it and come to a conclusion as to whether or not this is accurate or inaccurate and get it off the exchange if it's not accurate. We have a member-led governance process, just like a stock exchange or a commodity exchange, where our members set policy, our members set guidelines, and control how the other members are working within the exchange. We use distributed ledger technology to manage the data, and why this is so important is because we can assure everyone on the exchange that the information that's there has never been touched or modified in any way, shape, or form from the moment it entered the exchange until the moment somebody wants to purchase it. It also gives us a fantastic audit trail, if you will, to see through the life of some credential that's on the exchange, who's acquired it, how many times it's been used, how many times it's not been used, and so on and so forth, so that folks can be assured of the legitimacy of that information. And finally, from a technical perspective, we've built a very sophisticated validation engine. And why this is so important is that we are using technology to analyze the data that's contained within the verification information itself, to analyze that for alignment with another organization's requirements, right? And this is probably one of the most technically challenging things that we've ever, or that I've ever built, frankly, but also we've put into this platform, and it's truly a huge market differentiator for us, relative to our offerings. The network effects that are presented with ProCredEx are pretty significant, right? One, we use a membership model, and again, as I mentioned earlier, to limit access and to also confirm the appropriate use of the data. We don't want folks using ProCredEx to recruit people or to just willy-nilly go out and look at other people's information. So we've got both legal and membership driven rules around use of the data that we feel create a very high degree of trust and alignment across our memberships. We require that anybody who's selling data that they are an accredited organization, meaning they're Joint Commission accredited, NCQA accredited, or what have you, right? So you just can't have an organization out there that says they've got verified data that lacks any sort of formal accreditation from an industrial perspective. We have created a socialization process within the platform itself that brings together the people that do this work every day and allows them to communicate amongst themselves, to profile themselves, and act as mentors or as information sources within the platform, in a way that's never been done for the folks that do this work every day, right? And finally, with, as I mentioned earlier, the alignment of incentives is critical to any kind of digital marketplace. Frankly, healthcare is infamous for creating new solutions and then jamming them down the throats of the folks that they intended to use this with, right? And what we've done is created an environment where practitioners are relieved of all of this data administration and paper management significantly, where hospitals and healthcare delivery organizations, can get this information quickly, get people working faster, and also, monetize some of their data. For payers, they have a tremendous amount of credentialing data just through the natural function of insuring or millions of people and having tens of thousands of practitioners, if not hundreds of thousands of practitioners enrolled in their plans. And they also have all the credentialing data that's required for that, for that enrollment. So one, they have a significant monetization opportunity for all that data. Two, they have a lot of credentialing data supports their directory functions. And directory management is a huge problem for payers right now. And by allowing them to get this information at scale, they can look at this information for signals around changes to directory data and avoid the fees and the penalties and all that Medicare and Medicaid agencies are charging it for directory problems. So we think when we look at that alignment across a market, there's a very strong signals for participation. The bottom line relative to our value propositions are pretty simple. One, we get folks working and billing faster, right? Two, we reduce negative financial outcomes from having to do things like employ someone, but wait for months until they can actually start delivering care. And this is specifically a big problem with the contract medical staffing and telemedicine, acute care telemedicine spaces. Right, we simplify getting those hard credentials, that I mentioned earlier, and we recognize the fact that somebody has to spend days, weeks, and even months to get some piece of data verified. And by monetizing that, it recognizes the value of that work and creates a way for folks to take something that's always been a cost center and perhaps turn it into a little bit of a profit center, for their organization. Finally, we use our validation engine to curate this data. And why this is super important is that there are no standard credentialing rules across the industry. The regulators and the accreditors have high-level guidelines on what needs to be done for credentialing, but every organization has their own rules and requirements that conform to those guidelines. And what our engine does is says, look, you put in all those rules into ProCredEx. We're only going to present you with information that is aligned with your rules. So for example, let's say, you are a hospital, and for a general surgeon, you need all these, things, but you also need to verify that they've had training on the devices, let's say, that you use in your surgical suite. You can stipulate all of those rules into, within the exchange. And again, you will only see those, credentials that comply with those rules. What people do today is, frankly, memorize these rules, and there can be, hundreds of them. And as a credentialing professional, as you grow and gain experience, with an organization, you've got to build these rule sets in your head, go through all this data manually, and try to figure out if the data in toto complies with those rules, including all the permutations and so forth that data can have collectively. So, what we're really trying to do is help credentialing folks get out of the business of doing all this work in their head and using technology to analyze and curate that data accordingly. Finally, as I mentioned with our share model, we're greatly improving the transmission and distribution of credentials information amongst business partners where that's required, right? Today, I would say 99% of organizations create a bundled PDF, stick it in a secured email, and email that to their downstream customers, and hope that information complies with their requirements. There's tons of back and forth between the organizations relative to this doesn't work for me or that doesn't work for me, and ProCredEx eliminates that that friction, if you will, to commerce between these organizations. Finally, our go-to-market plan. We began pilots in June of this year with several of our partners. Those pilots use simulated data to just work through the UX and make sure that the big picture, deployment model worked and met their requirements. We are starting beta tests as we speak. We're actually loading live data right now into the exchange, and should have our very first transactions with live data done here very, very shortly. We are looking to turn the lights on in terms of live commercialization with our V1 in late January of 2021. And then we'll be working very, very, very aggressively over the next couple of years to rapidly scale the marketplace and grow our membership significantly. As you can see on the left of the screen, we've already developed a pretty significant network of leading healthcare organizations that represent a very diverse, collection of healthcare organizations. Everything from hospital systems, very large payers, hospital associations at the state level, payers. I think I mentioned that earlier, payers, big medical groups, medical staffing firms, local attendance firms, and so forth, all of which are committed to fixing the credentialing problem once and for all. So we're very excited about about our future, and we are initiating a Series A raise probably the beginning of the year next year, and looking to close that in the July-August timeframe of 2021. So that's the big picture, Kyle.
Awesome. I mean, it seems like a problem that is a huge headache. I mean, to talk about the complexities of all these different types of data points with all these different types of stakeholders who all need different types of data at different times, and then being able to manage that in a way that keeps privacy, but also gets people quickly getting work done. You have you have to work it out for you.
It's a monumental administrative headache across the industry. There is no one that, if you deliver or pay for patient care, you've got to credential a practitioner. And, as we are continuing the aggressive shift towards value-based care, basically being paid for the results and not being paid for volume, as has always been the case in the market, the need to stay on top, if you will, of credentials is magnified by an order of magnitude, right? And if you have a practitioner who is going to deliver care but is not experienced in a certain privilege, as we say, around delivering that care, it creates a huge amount of risk under a value-based model for both the patient and for the organization as well. So understanding the validity of credentials in real time is a absolute here and now problem, right?
Interesting. Well, I want to start off because you mentioned at the very beginning, but I just want to highlight it. I'm just curious, what's the backstory behind ProCredEx?
So as I mentioned in my intro, I ran a consulting firm for many, many years, and we did tons and tons of work around fixing credentialing, and creating very efficient, very frankly award-winning operations for the military specifically. And we were able to get cycle time for the military, for example, from 6 months from the day someone raised their hand to the day that they were actually able to deliver care to 18 days. But in reality, in 2020, for it to take 18 days to get someone credentialed and be able to go to work is ridiculous, right? We should be able to do this process in a couple of hours, right? And it's much like a background screening process, right? But there's more to it than that. And the delays that create this gap are tied entirely to a lack of a reliable, secure way and trusted way to get information from different counterparties in the market, right? And in my view, and what my colleagues and I looked at collectively, was everybody's doing this work. There's tons and tons of redundant data in the marketplace. Why in the world is everybody redoing the same thing that somebody else is doing? And it's just to point this out. If you're going to work for a hospital that has 20 payers that they have contracts with, and you have a residency verification that you did in 1988, 21 organizations are all going to contact that same program and ask them, did Dr. Smith complete his residency in good standing, before that person can be fully utilized and billable at the hospital that they're going to work for. It's ridiculous, right? And the reason why that's done is because there's mandates around primary source verification, But what we're doing is saying, look, somebody has primary source verified this credential, or 10 companies have primary source verified this credential, right? 10 organizations all can't be wrong, about something that will never change, right? The fact that Dr. Swift graduated the residency program in 1988 in good standing is never going to change. And today, every organization that I mentioned earlier goes out, writes a letter to that medical school and asks for the residency verification, and waits 3 weeks to get the letter mailed back to them that says, "Yep, Dr. Smith, was here." We're taking that data collectively and saying, "Look, 10 organizations have already done that. The statistical probability of this being wrong is nil." Right? And using that information to say, yes, I'll buy this verification from Blue Cross Blue Shield of wherever, and pay them $5 for it versus waiting 3 weeks to get this data myself.
Interesting. Well, I wanted to one of my first questions is jumping into how you guys collect credentialing data. What is your method of accessing that data?
Well, there's a significant amount of credentialing data with pretty much anyone we go to work with, right? Other than maybe a small practitioner's office. And at least in our go-to-market, we have an ingestion engine that we've built that allows an organization to extract data from their existing credentialing systems and post that electronically through our ingestion engine onto the exchange. The ingestion engine goes through the data itself, using our validation engine to just confirm that the data that is being submitted meets our minimum quality guidelines in terms of the data that's actually being submitted, by the class of credential that's being submitted. And then once it's ingested, it's then posted into a secure wrapper, if you will, and then placed on the ledger for consumption. So
interesting. And so I suppose that's the method in which there's two parts of what I feel like in assuring the quality of data that you're collecting is one, working directly with the provider or anyone that actually has provided the credential. And then on top of that, you have what you call the validation engine that looks through the data and make sure it verifies. Could you talk about those two pieces?
Yep. So, what we don't want to do is get in between the credentialing professional that's doing this work and the practitioner, right? They have an existing relationship and day-to-day dialogue that they're working through to get that person working, right? We don't want to create another thing that creates friction between that relationship, right? So our platform is really focused on the credentialing professionals themselves, right? So the credentialing professional is going to say to Dr. Smith, here's the application you need to fill out. Here's all the information I'm going to need from you. But that person can also go on to ProCredEx and say, what's here now, right? What do I need to acquire for this practitioner? Get all of that right now that is available, and only ask the practitioner for information that doesn't meet their requirements or isn't available for them on the exchange, right? So it's really heavily focused on the folks that do this work every day. And frankly, we don't want to add something else to for these professionals who work who already have enough administrative burden to begin with. Giving them another thing to do is not going to be a critical success for us, for sure.
Interesting. And so I mean, you talked a little bit already, but I really want to highlight this piece because I think it really makes you guys unique. Can you talk about the validation engine that you built and how it works?
Sure.
And why it's important?
So first of all, there's no standard that exists for structures of credentials data, right? So unlike HL7 or FHIR or what have you, there's no industrial standard that says a license, needs to look like this from a data structure perspective, or a board certification needs to look like this from a data structure perspective. There are a couple of forms, if you will. Again, it's 2020, but the health goes a little behind the times. There's a couple of standard forms out there that people use for different types of credentials. But for the most case, it's completely unstructured. So what we were challenged with is building a validation engine that could take very unstructured data, analyze it for material similarity, and then compare the data itself and determine whether or not it meets the defined rules of another organization, right? And everything about the definition of those rules, the application of those rules, the analysis of the data, and so forth. Something that took us a year and a half to build, and a couple $1 million worth of investment just to put that one capability together. It is a very, very sophisticated engine that has lots of applicability to use cases both within healthcare and any other regulated industry where credentialing is a requirement of employment.
Really interesting. I think that's one of the weird complexities. I mean, you mentioned now a couple times of the healthcare industry is that we have a mandate for regulation where there is no structure. So yeah. It's a free-for-all, which probably makes this process just a massive headache and huge risk for all stakeholders. Really, really impressive that you've built that feature in that engine. I want to. You've highlighted that you also use distributed ledger technology as a form of sharing data, and I'm curious, why did you use this tool, and is this your method in the backbone of how all of these different stakeholders are exchanging and using or viewing data?
Yeah, this is a great story around all this, right? In terms of the development of this whole concept. So, I read a white paper that was produced by the chief medical officer at Intel Corporation about 3 years ago. And in his white paper, he basically laid out how blockchain, quote unquote, could be used to basically solve the problem we've been talking around credentialing. He was also the state surgeon for the California National Guard. I reached out to him, and we had a couple of very good conversations around this topic. We had built the guts of the validation engine already, and we're looking, for a method to commercialize this. And long story short, he put me in touch with the folks at Hashed Health in Nashville, who basically have the most successful venture development studio around distributed ledger use cases in healthcare. And we spent about 6 months putting together a business model and did JV, which is what ProCredEx is around, creating this marketplace using DLT, and which is distributed ledger technology. I view distributed ledger in a very simple way, right? The historical software stack has been, for the last 20 years, has been UX, user experience, logic or programs, and data or persistence, right? Those three layers have made up the software stack and especially web apps for a very long time. What I believe distributed ledger does is creates a new layer in the stack called trust. It's as simple as that. You insert it between the logic and the data, where the applications themselves can test the data to ensure that the data has never been modified, right? And it gives us this layer of trust that we can ensure members that no one has gone into any of this data at any time and changed it in any way from the time it entered the exchange to the moment you're looking at it and relying upon it. And no other technology really provides that kind of reliable capability, right? We are not doing cryptocurrency. We're not doing anything, around any of that. We're using the distributed ledger to capture the state that document was in, or the credential verification was in at the moment it entered the exchange, and we're ensuring everyone who's either selling it or buying it that it has never been touched or modified in any way.
Interesting.
And that's something that can't be done with emailing or faxing or other methods of distributing data. This is one of the fundamental reasons why people don't share stuff today, because you get an email with a PDF in it, you have no idea that if the person sending it to modified it, right, or did anything with it whatsoever. So, DLT gives us that layer of trust, which is so important for this use case.
Interesting. Well, I think I really like your analogy about how it adds a layer of trust, and
Yep.
and it's I think it's a great way to look at the value of this specific type of tool.
Yeah.
I
think,
go ahead.
Oh, go ahead. I was to say, Kyle, there's also one other really important aspect, around our application of DLT. Blockchain type protocols are public protocols, right? And some of those early protocols that use distributed ledger to create an application, like Bitcoin or what have you, have a very simple metaphor that everybody has a copy of the ledger, the actual distributed ledger, and therefore everyone knows and can rely upon the fact that nothing's changed, right? That doesn't work in healthcare, right? And we have used a protocol developed by R3 Corporation called Corda, where everyone's ledger in the network is private to the member themselves and contains only the transactions that that they have elicited on the exchange. But the Corda or the Corda protocol itself is governed by, call it auditors and inspectors and everything else, and ensure that collectively all of those counterparty transactions are aligned. And this protocol was developed by the financial services industry because banks don't want other banks having their data per se on their ledger, on the node, if you will, right? And I think one of the hardest things that we had to do over the last 20 months or so was analyze all these different distributed ledger protocols that are available out there and pick one that would meet HIPAA requirements, that would meet high-tech requirements, and would also not expose potentially competitively sensitive information amongst other members to each other, right? And also from a performance perspective, we needed an environment that operated north of 300 to 400 transactions per second, right? And some of these older protocols struggled to get to 20 transactions a second. So, we really did a lot of work on what protocol was going to be right for this use case. And, that's anytime you hear folks talking about using DLT, those considerations have to be put, in front of the application of that technology in a healthcare setting.
Yeah, I agree with that point, where there's a lot of tools that can be used in healthcare, but if you don't understand the issues that healthcare has and the requirements that it's faced and the sensitivity of the data, you can get in some big trouble. And also it can be a big challenge and not exactly what providers are looking for, or any healthcare stakeholder in that case.
Right.
It's interesting because it seems like you have a bigger picture in mind. And I wanted to ask you, how are you approaching this digital identity space? I mean, it's a more broader question, a bigger step back, but I'm just curious because you have a lot of interesting moving parts here.
Yep. So there's a whole host of folks that are working on self-sovereign identity solutions for healthcare, and we think that those solutions are fantastic, right? Being able to have a practitioner store and manage all this information on a digital wallet, if you will, and distribute that information to their downstream healthcare relationships. What we are doing is quite different from that, insofar as rather than managing the endpoint practitioner and then having to create a network of all of the sources of that data collectively, like every licensing authority or bundler of licensed data or what have you, we're leveraging the existing data and the existing processes that are happening in the market today, and creating a way for folks to do something now versus create a solution that requires adoption across 900,000 practitioners in the marketplace. So what we're doing that's different is we're not creating a solution that requires every practitioner, every nurse, every primary source, and so forth, or data aggregators or what have you, to come together to form a solution that works at a market level. We believe that will happen in the future. What we're doing today is creating a solution that works now. the credentialing professionals that do this work every day, that already have all this data and simply need a mechanism to exchange that data. Secondarily, the credential artifacts themselves that would be distributed, let's say through a wallet, still require verification. Somebody has to go and contact the source of that information and verify that it's accurate and complete. So we're, again, creating a solution that enables today's world, but we do see, in the future that, these identity solutions will definitely come to the market and will be very valuable. And we believe that we can work together with those capabilities to provide them the verifications that are needed to support the identity claims that are made in the wallets. So that's
exciting. No, it definitely makes sense. And I think one of the biggest challenges in working with healthcare is, there is this idea in which we want to make huge transformational shifts that generally look good on the outside. Like you said, there is a future that we can envision that, managing data in a certain way would make sense, but it's really hard to implement that and really difficult to work with healthcare stakeholders. And regulation makes it impossible to make those big jumps. And also you're changing the workflow of people's daily lives and being able to make, I wouldn't say incremental shift, but it's a huge jump from what you talked about, a lot of credentialing experts that have to do today, from what their existing workflow is to what they can do using ProCredEx, and then being able to leverage that as a tool to even work more efficiently, but not completely just disrupting their day-to-day lives.
So in the investment world, the displacement risk around credentialing solutions is probably as high as one could ever manage or measure, because if you're building credentialing software, for example, pulling out some of these existing credentialing software and putting in something new is a massive disruption to day-to-day operations for these folks. Regardless, they've got to keep credentialing every day, right? So we intentionally built a solution that did not was not interruptive or disruptive or what you may, to their existing processes and systems. We just give them a new tool to use to, go on the web, look for stuff. If they can find it, buy it. If they've got stuff they want to sell, they can put it on the exchange. And it's a hands-free, way of putting on the exchange, and it's simple, right? And we believe that that's a key component of even our early success thus far. So,
really interesting. No, it's impressive, and I think it's a great approach, and it's practical, but yet still very innovative. And I think, I'm curious to follow up from this point. What does that actual implementation process look like for a lot of your users? I mean, is it difficult to import data? Is it difficult to use the platform? How does it integrate with their existing workflow?
Not at all, right? It's very, first of all, it requires virtually no effort from the credentialing folks that do this work every day. They can do their work in an uninterrupted fashion. We work either with their vendor or their internal IT team, the credentialing software vendor, or as I mentioned, their internal IT folks, to create an extraction routine that takes this data and puts it into a data structure that we can then point to our API or an ingestion engine to pull into the platform. We go through that data and cull it and determine if there's any errors or any unsatisfactory data, if you will, that doesn't meet the minimum standards for the exchange, and then post it to the exchange, and then it's just there, right? And then people can if the verifications meet the requirements of future member needs, it will then be presented and it can be acquired and so forth, by those endpoints across the marketplace, right? So we our ingestion engine is fairly sophisticated, and it was built specifically to ingest very unstructured data as it is, right, and not require some hugely complex ingestion or API capability. Right? We know, we worked for so many years in this space. We know how difficult getting data is out of some of these systems, and how, in some cases, how challenging that can be from a structure perspective. And so we intentionally built something that would deal with that reality and not create a huge amount of friction from an onboarding perspective.
Really cool. No, it's impressive that you've built out a process that really doesn't change any workflow for the credentialing managers and users.
Yep.
And I think it's super important because, like you mentioned even earlier, that these people don't have the time to relearn something new. They don't have the bandwidth. I mean, credentialing is a really intensive process and a lot of work. So it's great that the implementation process and how it integrates to existing workflow is seamless. And I think that's a huge competitive advantage.
Exactly.
And I'm kind of curious, I want us to take an even bigger step back a little bit, more general healthcare market questions. Healthcare software is notorious for having very long sales cycles. It's difficult to work with providers and different types of healthcare stakeholders. Do you face this problem? And, if so, how do you manage it?
So, it's a great question. And our strategy is very simple. Go and take advantage of existing networks, commercial networks that already exist, where credentialing is a function of that network itself, right? So, for example, we've got a couple of our initial partners that we're going into beta tests with in the next couple of weeks that have existing commercial networks that total 2,000 different points, 2,000 different organizations. And we're deploying across that network because they have to share credentials information, right? So scale is everything with a digital marketplace. And by onboarding these customers or regional consortia, if you will, that have these very large existing networks, we can put ProCredEx out there across this network and rapidly scale, right? So, that's how we believe our most successful go-to-market will be. And, to have in healthcare, enterprise healthcare technology sales, to be able to say, look, in year 2 of our life, we're deployed across 5,000 different organizations. That's unheard of, right? And that's exactly, why we're taking the strategy that we're taking to get to market quickly.
Interesting. Really impressive. It's especially in the healthcare space, 5,000 organizations. Yeah. You're gonna have.
Well, it's also the beauty of cloud. It's also the beauty of cloud-based apps, right? Where we're not going in and doing an install, and spending 8 months configuring something, right? Our install can take a couple of days at most. It should be a couple of hours to get all the rules configured and get the users loaded up and all that kind of stuff, and then maybe several weeks to develop the data ingestion process if they're a producer on the exchange, and tested, get it developed and tested and through our QA process. And it's we have to be low touch, low friction. Otherwise, like I said, sales cycle is going to take forever, and it's going to raise the price of everything and all that stuff, right? So we're really focused on getting to market quickly and providing it just a fantastic tool for the folks who do this work every day to continue to do that work, but improve their cycle times and reduce the cycle times dramatically.
Interesting, really interesting. Well, I want to highlight, because you talked about it earlier in introduction on the slides. You have the business model that you have is more of a membership-based model, which is I'm assuming that it's a subscription tool, but especially a lot of your users can also monetize their existing data using their platform. So it's a cost savings and a money maker, which is, it's hard to get two of those at the same time. So, can you elaborate more?
We really like it. Yeah, we love the model. It's fantastic. It's truly a digital marketplace, right? Where you can be, if you're an accredited organization, you can be both a buyer and a seller. If you're not accredited, you can buy or share information and then turn this data that's historically had very little value into something that has a tremendous amount of value and create a pretty significant revenue stream from it, right? So we're still very early stage as a firm, but the the degree of interest that we've seen in the marketplace, I in my 30 years of building startups, I've never seen anything close to it. It's very exciting, and I think everybody collectively is ready to see improvements in this process, and are looking for something that that is simple, easy, and effective to implement, right? And not you don't have to turn their world over to make it work. Rather, just take this existing information that's out there and create a venue for folks to collaborate collectively and securely on. Right?
Interesting. And I just want to highlight for the audience, and can you share with us the size of this problem? And maybe it could be global or just the United States.
So in the U.S., we have built a very sophisticated model out, that looks at just the use cases of practitioners seeking and sustaining employment in hospitals, in large and small practitioner groups, and enrollment with those payers that work with those organizations, right? Just those segments in healthcare. And across those segments, there are about 220 million credential verification transactions that take place every year, right? Every year. So that's when I talked about performance of the distributed ledger. Just to support that use case, you can't have 20 transactions per second, right? You've got to be in the hundreds of transactions per second to be able to support just that volume alone. Then you add in telemedicine, outpatient work, local tenants, contract medical staffing, all these other segments that also have to do credentialing work, and the combinations and permutations of the relationships that they have with their customers that need to consume their credentials data, right? And we've seen a total addressable market that is north of about $5 billion a year. So it's a huge market, huge. And the cost, payers alone, right now, I believe it was a study that was done by Berkeley Research Group last year found that payers are spending $2.3 billion a year to just keep their directory data clean, right? And if we can just that problem, it's incredible, right? And if we can provide those folks with resources and tools to help them on that problem, I think there'd be a significant opportunity there as well, right?
Crazy. It's so unique how, it seems from the outside in, if this is not your day-to-day life of dealing with the credentialing issue, it would be such a niche in a problem that doesn't seem as big as you'd think. But when you really look at the logistics that we talk about, how many times you have to pass this data around for all these different, and just for this specific use case. You're not even talking about all the other different types of practitioners or other use cases that you can get into. It is really, really a big problem that needs to be solved.
It is. And relative to the here and now, COVID has basically unleashed telemedicine, right? Unleashed it. And it is exploding in both what we call the B2C, which is patient to practitioner telemedicine, as well as the B2B or acute care telemedicine for things like stroke, telepsychiatry, emergency room support, intensive care support, and things like that. In order to form those relationships, especially on the B2B side, you have to get the person credentialed at the endpoint that where you want that person to provide virtual care. If you're in that business, you may have 400 hospitals that are downstream clients of yours. Every new hire you bring in, you've got to credential that person, and then they've got to be credentialed by every single one of those endpoints before that person can be fully utilizable. Meanwhile, you're paying a salary. You're not improving your capacity by any stretch, and the downstream organization is not fully able to leverage that relationship until credentialing is done. And that alone has cast just a massive spotlight on this problem, because as one of the founders of the telemedicine industry told me a year ago, credentialing is its Achilles heel to growth, period. And if we can solve that problem, we can dramatically improve practitioner mobility, practitioner, capability, or not sorry, capability, but availability and so forth, and really help to change the way, virtual care is emerging, in the market itself.
Really interesting. And I think you kind of already highlighted and really answered my question about how the pandemic has affected your company. It's really created a bigger opportunity.
It has laid bare the need to fix this problem, laid it bare. And thank God we've had no one in our firm that we know of, come down with this awful disease. We have all been working virtually and have been uninterrupted in terms of productivity. So there's no issue with us internally, but I hate to even say it, the upside, I know it's terrible talking about something like that in a pandemic, but the upside is that it has really shown the need to fix this problem once and for all at an industrial level.
It really, I feel like the pandemic has really highlighted and shown light on a lot of the bottlenecks within healthcare. Yep. And has created kind of that silver lining to really push a lot of healthcare stakeholders that have been really trying not to change anything to really seriously consider and start to implement new processes that could change an infrastructure that's been kind of difficult to work with and processes that are difficult to work with. So it's definitely it's great to hear that you've now are enabling, especially for example, telemedicine companies to grow quickly and address and help out a lot of patients that are in need of help, but maybe not able to get enough access to providers because they can't be available due to a bottleneck, right? Mm-hmm. Credentialing being one of them. So it's really impressive that you're in this space. You've touched on this earlier. We talked about the future of what you think is patient or identity or managing identity. Or digital identity. I'm just curious, what do you think is the future of credentialing management? And what do you see most people don't?
So, we believe that it's, that the future is all about access to information and being able to simplify the analytics process that goes on around credentialing. Today, an individual, a medical staff professional goes through the process of gathering all the documents and claims to credentials that a practitioner has, upon an application for employment or contracting or whatever. They go through this information, collect the verifications from wherever they need to collect them. It's usually 40 to 50 different things that you get verified. Do that work, and then in their mind, try to figure out if it makes sense, right? And if it meets their requirements. Then there are a series of analyses that are done, for example, by the department head of who's going to, possibly employ this person. Then the credentialing committee, right, reviews the information. Then the medical executive committee reviews the information. And ultimately, it's presented to the board of directors for final approval. Well, for all steps except the board of director review, those analyses are intended to make sure somebody downstream didn't miss something, right? And there's not something there that doesn't feel right or fit into the requirements for that organization, right? And we believe that both with the ways that we're making the data available, as well as through our analytics engine, that a lot of that process of checking and rechecking everybody else's work to make sure you didn't miss something can be greatly improved through technology, and we can dramatically improve the time it takes from when Dr. Jones signs a contract for employment to when Dr. Jones is fully billable and utilized in the organization, right? Even incremental improvements, have a tremendous impact on net revenue recognition for an organization, being able to get folks working and billing faster, right?
Interesting.
So that's where we see the future going. And then I love the whole self-sovereign, identity, play and the, and the digital wallet concept and all that. And, we sort of see that dovetailing into what we're doing, but it's going to be a while. It's going to be a few years, down the road before I think the market's ready to adopt something like that at scale.
Interesting. Well, with that, Anthony, thank you so much for taking the time to chat with me. I really appreciate it. I know we went a couple of minutes over time. Before I close out, did you have any other closing remarks that you wanted to make, announcements, ask the audience, anything?
You know, as I mentioned earlier, you know, we are in the business of our Series A raise. You know, we're going to start that formally in January. But if anyone's interested in learning more about that, by all means, you know, reach out and we'll get you the information that you're looking for. Our last round, our seed round, was led by Spectrum Health Ventures in Michigan, and you know, have lots of very strategic, you know, and very strategic companies and some angels and so forth in that round that we're very proud of. And we're looking, you know, for our Series A to bring, you know, everything we need to the table to help us grow this thing like mad. So, so if you're interested, please let us know. We'll be happy to chat with you.
Wonderful. Well, with that, Anthony, thank you so much for taking the time. And again, to recap for the audience, why we had this interview. I mean, you saw it today, why ProCredEx is an extremely impressive data management tool for credentials. Not only have you simplified the process of collecting data, but also validating with the unique validation engine, you've been able to build out a process that scales the ability to share this type of data that you're collecting with your unique distributed ledger that's is formed in a way that's specific to the end user, where they can only view a specific set of information that's important to them, very important for the healthcare ecosystem. But on top of that, you've built a platform that really does not change the end user's workflow. It's a simple implementation. You've drastically increased their ability to perform their work in a much faster manner. You're saving costs. You're also helping some of your users generate revenue from the data that they have. You've built out a marketplace that's practical for all healthcare stakeholders, information that they need, but only information they need to know, and not being able to abuse that information, and being able to manage a proper healthcare marketplace of data. Super impressive. And there's more features on top of all of this. So it's really impressive what you've been able to build, and I'm super excited for your future. Thank you so much for taking the time to do this. This is impressive.
Yeah, you're very kind. Thank you very much. And it's a pleasure to meet you and your audience. Have a great day.